lives per year, says new WHO report. Half of the world's population still does not have adequate access to safe drinking water, sanitation, and hygiene, which could have prevented at least 1.4 million deaths and 74 million disability adjusted life years in 2019, according to the latest report by the World Health Organization and an accompanying article published in the Lancet. With growing wash related health risks seen already today through conflicts, the emergence of antimicrobial resistance, the re-emergence of cholera hotspots, and the long-term threats from climate change. The imperative to invest is stronger than ever, said Dr. Maria Nera, Director, WHO Department of Environment, Climate Change and Health. We have seen improvements in wash service levels over the last 10 years, but progress is uneven and insufficient. Burden of disease attributable to unsafe drinking water, sanitation, and hygiene. 2019 update presents estimates of the burden of disease attributable to unsafe drinking water, sanitation, and hygiene for 183 WHO member states disaggregated by region, age, and sex for the year 2019. The estimates are based on the four health outcomes: diarrhea, acute respiratory infections, undernutrition, and soil transmitted helminthiasis. Helminthiasis. Diarrheal disease accounted for most of the attributable burden, with over 1 million deaths and 55 million dailies. The second largest contributor was acute respiratory infection from inadequate hand hygiene, which was linked to 3,56,000 deaths and 17 million dailies. Among the children under 5, unsafe wash was responsible for 3,95,000 deaths and 37 million deaths, representing 7.6% of all deaths and 7.5% of all deaths in this age group. This included 2,73,000 deaths from diarrhea and 1,12,000 deaths from acute respiratory infection. These diseases are the top two infection cause of death for children under 5 globally. Important disparities were noted between regions and income groups. More than 3/4 of all wash attributable deaths occurred in the WHO African and Southeast Asia region, while 89% of attributable deaths were from low and lower middle income countries. However, even high income countries are at the risk, as 18% of their diarrheal disease burden could be prevented through improved hand hygiene practices. While these estimates included 4 health outcomes for which data were available to quantify the impact, the true burden is likely to be much higher. The impacts of unsafe wash on health are wide ranging and go beyond disease by affecting social and mental well-being. In addition, climate change is likely to exacerbate many wash-related diseases and risks which are not fully captured in the present estimates. To reduce the wash attributable burden of disease, WHO urges governments to take the following action with support from UN agencies, multilateral partners, the private sector, and civil society organizations. Radically accelerate action to make safe wash a reality for all. The midterm comprehensive review of the International Decade for Action toward the Sustainable Development Goals saw renewed commitments from government to accelerate progress toward the goal of universal access to safe wash by quantifying for the first time the health gains associated with the higher wash service levels. The updated estimates provide strong evidence to support efforts to take these commitments to action. Focus efforts on the protest and most disadvantaged. The burden of disease is largely driven by inadequate access in low and middle income countries, and national estimates on wash access often hide disparities within countries. Access to wash services is typically lower among the rural population and lower socioeconomic groups, even in high income countries where access to safely managed drinking water and sanitation services is generally high. Certain marginalized communities are underserved and face higher risk. Adapt national monitoring system to improve data on population exposure to safely managed services. Data on higher levels of wash services remain sparse in many countries. Governments should adapt national and local monitoring system taking into consideration to higher service levels called for the SDG framework, enabling a more accurate infection of the full burden of disease associated with unsafe wash. It is clear that inadequate access to safe water, sanitation, hygiene services continues to pose a significant and preventable health risk, particularly to the most vulnerable populations, said Mr. Bruce Gordon, head WHO Water, Sanitation, Hygiene and Health Unit. The health benefits as quantified in the report are immense. Prioritizing those most in need is not just a moral imperative, is not just a moral imperative, it is key to addressing the disproportionate disease burden in low and middle income countries and among marginalized groups in high income countries. To support governments, WHO also today released a new tool to model disease impacts from different wash scenarios. The tool will foster informed policy making, guide targeted interventions, and support strategic resource allocation for WASH programming. Thank you. Please subscribe, like, and comment.